Good afternoon, AustCham, and I'd like to welcome you to meet one of our major sponsors from Bangkok Hospital. I have with me Dr. Nisha. There's some questions I'd like to ask you, and firstly I'd like to have a bit of an introduction with you. So I'd like you to talk a little bit about Bangkok Hospital, how it evolved in terms of its vision and perhaps where it's going.
Bangkok Hospital vision is we would like to be a medical hub in the area of the the Asia Pacific area. We have evolved over the years. We were founded in 1972, and over the past 53 years, we have grown into the super tertiary care level of facility with multiple specialties, subspecialties that we offer. We have become one of the top 5 private hospital in Thailand, and what our philosophy is that we want to integrate the advance in medicine together with compassion. We focus on providing good patient experience while maintaining the high clinical standards. So that's what we're aiming for.
What do you think some of the major achievements have been in the recent times for the hospital?
Well, talking about achievements, we have received multiple awards. Like recently, we have been, recognized as one of the top hospitals in Newsweek and Statista. And we also have been, for example, some of our hospitals, like the specialty hospital, for example, the Brain and Bone Hospital, which is the Bangkok International Hospital, have been awarded the best specialty hospital in the world.
What makes Bangkok Hospital, what is unique about its leadership and its strategy that sets it apart?
Well, I think because we stick to our philosophy, like I mentioned. We don't only try or thrive to provide a high standard of care for a good clinical outcome, but we believe that true leadership, especially in healthcare, is not only to achieve the most advanced technology, but also we want to be providing compassionate. We want to be giving empathy, and we want a deep understanding of the patient's need. We want to be, I think our uniqueness is because, of course, we have Thai culture. We have this, what is called a Thai hospitality that we want to integrate into our care when we provide the care to the patients. So I think a lot of patients that have come to our hospital, what they love about it is not only because we have a good clinical standard practice, but because we have this kind of charm about when we provide them with the warmth of Thai hospitality, when we provide them with care.
So how do you measure that excellence? What does the hospital use to measure its success in this area of excellence?
Well, we continuously, get the, patient's review, patient feedback each time they come to the hospital. And you can actually look on the Google reviewed. We have received a lot of positive reviews, and I think one of the most things that they mention is our service, our service mind, our care, because let's talk about international patients. They come here because of our expertise in medicine, but of course when they arrive, we provide them with comprehensive support, starting from transportation from the airport. We help them with the flight and hotel booking. We do provide them with visa extension service and insurance coordination. So we are well equipped to provide care to international patients.
To remain ahead of the game, there's a certain amount of innovation that has to go into the hospital. What is the hospital perhaps targeting in terms of innovation for the future to to ensure that it keeps the hospital, I guess, ahead of the other competitors.
Exactly. Well, that's one thing that we continuously improve as well. We want to stay in the forefront of all these technologies. We recently launched the robot hub, the most advanced robot hub in Southeast Asia. So pretty much we integrated robotic assisted surgeries into our procedures. We do have multiple areas of surgeries that we use this robotic assisted technique. For example, like thoracic, abdominal, urological, gynecology, orthopedics, and neurosurgeries. And with those robotic assisted surgeries, it pretty much improved precision and accuracy of surgeries. It decreased the intraoperative complications, and also it improved the recovery for patients. Pretty much they have like faster recovery.
Medical tourism plays a big role in Thailand in terms of the way the government promotes it and uses it as part of the strategy for Thailand. What is Bangkok Hospital's role in medical tourism?
Well, yeah, because we all know that Bangkok is one of the, I think, most popular destinations in terms of tourism. And for medical tourism, apart from these comprehensive support for international patients that I mentioned, also, we have what is called a medevac center for us. It's a medical evacuation center that we provide support in terms of transportation for patients. We have collaboration with multiple local and international facilities that we would, help transport them here and there, and our medevac center is also CAMP certified, which is, we were recognized to be like a standard kind of evacuation service as well.
And you mentioned the word, collaboration. So on the international stage, you collaborate with other hospitals or other countries?
Well, yeah, BDMS itself, we are the biggest network in like Southeast Asia. So we have the in-network collaboration with other hospitals as well. But also, for the outside of the network, because we do have a lot of relationships and collaborations with insurance company, agency, so we do communicate with among inside and outside network.
Okay. As with any big, company and corporation, the community and I guess community collaboration. What sort of things does Bangkok Hospital do with the community?
We do have what is called Wait to Sit Foundation, which this foundation is the way that we're trying to give back to the society. We provide education, training, or donations to all the disabilities and underserved kind of area or people.
In the long term, I'm assuming that the hospital has a vision of growth. Mm-hmm. Is it going to grow within Asia or ASEAN?
Well, that's what our vision. We want to be the medical hub in the Asia Pacific area, and we have tried and integrated a lot of technology into our service. Actually, I mentioned about the robot hub, and in the near future, we're also going to have the proton therapy for advanced radiotherapy for cancer patients as well. So we are looking forward to, receiving or accepting a lot of patients in this area in the Asia Pacific to come to us for advanced treatment.
What other things would our members and the people that are going to watch this want to know about Bangkok Hospital?
I'm sure a lot of places in Asia or in the world, they may have similar or even maybe more advanced technologies. But I think our uniqueness and our charm, like I mentioned, is that we do care about patients' journey. You know, we believe that to provide great medical care is not only to achieve the best technology or to achieve the best clinical outcome, but we feel that in order to do that, in order to give good medical care is we have to make the patient's journey or experience as good as possible as well. So I think that's what you are going to get if you come to us.
Look, I'd like to thank you, Dr. Podnisha, for coming in and speaking to us. And I know Bangkok Hospital has been a long member of, or long sponsor of AustCham, and we thank you very much for that. So
thank you very much for having us, and we've been in collaboration with AustCham for over 10 years.
It's been a while. Thank you very much, AustCham, for watching. Take care.